All right. So I am super excited to chat with Dr. Tabatha Barber. We're going to be talking about her new book, Fast to Faith. We're going to be talking about hormones. And thank you so much for joining us, Dr. Barber. Appreciate you being here and really excited about your book. Again, we're going to talk about fasting, talk about how fasting impacts the hormones and your experience with Hashimoto's. And again, thank you so much for joining us.
Oh, thank you for having me. This is such an important conversation. I think so many women are going to benefit from this.
Yeah, no, I definitely agree. And let's talk about your a little bit more of your background. So, you're a functional OBGYN and functional gynecologist. And, what I guess what prompted you first of all to write this book, from fast to faith and then also, just how did you start because most gynecologists don't practice functional medicine. So how did that journey begin?
Oh, well, it's a long, convoluted story, so I'll shorten it up. But essentially, I got pregnant in high school and I had a very traumatic delivery. And out of that experience, I kind of had a come to Jesus moment where I realized that God wanted me to help other women not go through what I went through. And so I figured out how to, I was a high school dropout. I went back to school, I got my GED, and I became a doctor. The idea was that I was going to help women have a voice and a choice in their care and not have to suffer and go through what I went through. But unfortunately, the medical system is not set up for health or wellness, either for the patient or the doctor, right? And so, about 10 years into my practice, I found myself miserable. Here, I thought I was living into God's purpose for me. I had done everything I was supposed to do, and yet I was barely surviving. I had chronic back pain. I had Hashimoto's that was uncontrolled. I had depression and heart reflux and IBS and depression, like all these drugs that I was on, all these diagnoses. And I reached my breaking point and realized this isn't sustainable. I'm not actually helping women long term, and I can't continue on this. So I started down the path of figuring out, okay, how do I heal myself? And that's how I found functional medicine. And I realized what I was doing was a lot of band-aid medicine. I was helping people relieve their symptoms, but I wasn't really figuring out what was causing it, right? So I was giving birth control pills for heavy periods and mood swings and acne. Like that was the end all be all treatment. Or I would do surgery. And a lot of women are surprised to hear that OBGYNs are actually surgeons. I spent 4 years learning how to do a hysterectomy 4 different ways, how to do C-sections and deliveries and procedures. I didn't study hormone imbalances and all the intricacies of the endocrine system and how our gut health impacts our overall health. And so we look to OBGYNs as hormone experts, but they're really not. They're surgeons. And so I found myself in this dilemma of like how to really care for women. And it wasn't until I healed myself with functional medicine that, I realized what I needed to be doing. So about a year and a half ago, I just got a download from God, honestly. I can't explain it any other way, but he's made it clear, like, you have a new purpose. Like, you fulfilled that. You're supposed to be doing what you're doing, but now we have a new plan. Like, you have to write this book. You have to create this program. You have to teach women how to love themselves again, how to love their bodies back into healing, because all day, every day, I was just seeing women complaining about their bodies, hating their bodies, feeling frustrated, like at war with their bodies because of pain, because it wouldn't do what they wanted it to do, because they couldn't release extra weight. It didn't look the way they wanted it to look, all the things. And so that is really what I've been focused on the past 15 months, is bringing women the truth, like the functional medicine, everything I learned, like I just poured it into this book so women could really start to understand what the heck is going on in my body. Why don't I even recognize myself anymore? Why do I have Hashimoto's or some autoimmune disease? Why are my hormones out of whack? Why are my adrenals tanked? Like, I explain all of that. And then the cool thing is, like, I just lay out a plan that's free and easy, because fasting is free, on how to really get back in tune with your body and start to listen to it again. And that's where the magic happens.
Yeah, very eye-opening. So OBGYNs, not a surprise that they don't focus on the gut, that they don't have a lot of knowledge about leaky gut, healing the gut. But then when you said that they're not hormone experts, because a lot of people have the perception, oh, I'm going to go to my OBGYN and, ask them for hormone panel. And not that some of them won't order it, but just for you to say that they're more surgeons than hormone experts, I think will surprise a lot of people.
Yeah, I had very minimal training in how to handle a menopausal woman. I was definitely trained on what preventative tests to order, like a colonoscopy, a mammogram, a lipid panel to test your cholesterol. But I was explaining this on a podcast earlier today. The medical system was created out of an acute care problem. We were trying to treat infections and save people's lives and do life-saving surgeries and things like that. And so the whole world of medicine comes from the idea of pathology and disease. It doesn't come from a standpoint of health and wellness. And so we're just looking to the wrong people for answers about how to get well, how to reverse disease, because that's not what doctors are trained to do. They honestly don't know that. I didn't know that. And I was really well trained, but that's not what you learn. And so it wasn't until I went on and got a ton more training that I actually started to understand and comprehend the idea that I was practicing Band-Aid medicine. If you came to me with typical symptoms of thyroid disease, my only solution was Synthroid. That's honestly all I knew. Or you need to go have your thyroid removed if it's acting up and overgrowing, because as a surgeon, we're just taught, like, remove the offending organ. The uterus is bleeding too much, just remove it. The gallbladder's creating stones, just remove it. The appendix is inflamed, just remove it. That's the mentality. And it breaks my heart that I used to think that way and practice that way. But it wasn't until I had failed my back surgery and I was laying in bed for 7 days, I think it was. But the third or fourth day, I realized I hadn't eaten at all. And I was like, why am I not hungry? Why don't I even care about eating? And then I remembered, when I was doing my surgery rotations, one of the first things we learned as a student was how to write NPO orders. So we would tell the nurses, don't feed this patient who just had surgery. You cannot feed them until we give you an order, and then you can feed them. And so as surgeons, we know that fasting is part of the healing process. And my body was just doing that innately. It was not wanting to eat because I was trying to recover from this back injury. And so, I'm laying in bed. I can't do anything else except talk to God. And I got so much clarity that week of, wow, when I stop giving into all my bodily cravings and desires and just let my physical desires drive everything, my mind can open up and I can actually reestablish that connection with my creator and get so much clarity, and I can heal. Because this, when we eat, we need resources. It requires energy and supplies to actually break down the food, digest the food, absorb the vitamins and the minerals from the food. So it's a very active, energy heavy process. And if you're eating all of the time, you can't heal and take care of other things throughout the body. And so if you fast, you can divert those resources to where they need to go. And it's a pretty incredible process. So God said, teach people how to do this, because that is the innate intelligence of your body to heal.
Yeah, definitely agree. Uh, when it comes to fasting, I mean, there's different types of fasting, like 16/8 fast, 24-hour fast, 3-day water fast. What do you, I guess, what do you practice yourself, and what do you typically recommend to patients?
That's a great question. So, my program is 40 days long, and I developed it after listening to my patients over and over and watching them work with the nutritionist and seeing where they were struggling. And time again, women would tell me, I can't fast. It's too hard. That's too long. And they would have symptoms. And what I realized was they were stuck in sugar burning mode. They were eating a lot of carbohydrates and using that immediate blood sugar to get through their day for their energy. And whatever was left over, they would store it as fat. That's what we do. Women aren't eating enough healthy fats and protein. One, because we were told fat makes you fat for decades, which is absolutely not true. But women are afraid to eat healthy fats. And when you use fats to burn fuel, you are satiated longer, so you're not as hungry as quickly. You don't ride the hangry roller coaster of the blood sugar issues, and you can go into ketosis, which sets you up for success with fasting. So, the process of fasting, we have to retrain our bodies how to do the innate intelligence it was designed to do, because honestly, when we were created forever ago, we didn't have grocery stores on every corner, right? Like, we didn't have access to unlimited food 24/7. We didn't have DoorDash and all this crazy stuff. So our bodies know how to go quite long time periods without food, how to feast, and then how to famine again. And so all you have to do is break up with snacking, break up with sugar, get back down to your normal 3 meals a day, and then you can start to shrink your eating window. And then you can start to drop off a meal and go only a dinner and maybe a lunch, or do a 24-hour fast. But it's like learning how to run. People don't just get up and run 5K very often. The ones that do, that's pretty awesome. But most people do like a couch to 5K, right? Like, they get the training manual and every day they slowly increase what they're doing and add on to it. And that's fasting. You have to retrain your body how to burn fat for fuel instead of sugar for fuel. So we use all of it. We begin by getting into ketosis and burning fat for fuel. We play around with that eating window. 16/8 is the most common, and that's where most people feel good long term and have long term benefits. Like, I don't think our bodies were created to eat 24/7. They just weren't. You should not. It's too hard on the pancreas. It's too hard on the body. And so you should be eating in a 6 to 8 hour window on a regular basis. And then we can add in longer fasts depending on your goals. Are you trying to lose weight? Are you trying to get mental clarity? Are you trying to heal from an injury or reverse a disease process? Like, what is your motivation behind that? And I teach all of that in the online version of my program. And it's been such a game changer for women, because nobody's talking about this. People are just like, well, we can all fast the same and you should be able to do it. And people feel like a failure if they just can't get on board with the trend and do it. And it's not a trend. It's actually how God created your body to function. You just have to remind it what to do.
And so it's more just about losing weight. Obviously, fasting can definitely help people to lose weight, but you mentioned healing, just overall healing. So it could benefit people with all different conditions, all different health conditions. Again, most people listening to this have a thyroid, autoimmune thyroid condition. Again, you dealt with Hashimoto's, so I imagine fasting is a big part of, people with Hashimoto's, that patients that you see with Hashimoto's. Uh, but yeah, so it's not just about what, because again, I would say that most people who fast, at least initially, or a lot of people who fast initially, they're doing it to lose weight, but it goes way beyond just losing weight, if I understand you correctly.
If you do it right. So weight loss is like a side effect. It's a benefit of getting healthy. And I'm hearing a new trend where people are poo-pooing fasting if there is any kind of thyroid disease. Oh, you shouldn't fast. You have an autoimmune condition. You shouldn't fast. You have hypothyroidism. And that's really just not true. That is not how our physiology is designed. It's actually beneficial for people with thyroid conditions and autoimmune conditions. But the key is to do it in a way that your body doesn't think you're starving. So we know that thyroid, being the master gland that it is, it's trying to regulate all of our resources. It's taking in information from our adrenal glands, from our gut, from our immune system, from our sex hormones, and it's trying to keep everything in balance. And it affects your thermostat, your metabolism, how quickly your bowels move, how quickly your hair grows. Like, it affects everything. And it responds to all the stimuli coming in, the environmental stimuli, the internal stimuli, and it decides who gets the resources. So this is what I love explaining to women. Your thyroid doesn't just become sluggish and fail you. Your thyroid is actually protecting you. It's doing its job a lot of the times when it's shifting resources, or quote unquote down regulating, I call it, where you kind of look like you're going into a hypothyroid picture and nobody's checking your full lab panel, right? And so your reverse T3 is really high and your free T3 is really kind of getting on the lower end. It's because your thyroid is responding to something that's happening, either a gut imbalance or infection, heavy metal exposure, a virus you just got, an autoimmune attack on your thyroid. And so if you can just remember that your body is working for you and it's doing its best to actually keep you in balance and protect you, and stop being mad at it, then you'll be able to know what it needs and pull it out of that situation. So when I see women coming to me with hypothyroidism and they've gained weight, they immediately just focus, I want to lose the weight. I want to lose the weight. But we have to figure out, why is your body and your thyroid downregulating and sending out resources elsewhere? It's because you have gut dysbiosis that we need to treat. And when you actually treat those root causes, a lot of times I see the thyroid shift and go back into balance because it's no longer worried, or trying to treat this infection or deal with something else. And so you have to start listening to your body. And we do this as children. We know we're strong with our intuition. We hear what our body has to say, but we get trained by grown-ups to ignore it and to cover it up with medications and over-the-counter stuff, and to just think of it as a nuisance. And so when your body's like giving you little signs in the beginning, oh, your skin's a little dry, oh, you're getting a little constipated, oh, your brain isn't functioning very well. Like, we just keep ignoring all the symptoms instead of going, I wonder what's got the thyroid angry. Maybe we should evaluate, why is the thyroid shifting how it's functioning? And when we do that, we can figure out the root cause and treat it. And oftentimes that we can finally release the weight. But part of it is that fasting stops all of the stuff happening in the gut. the gut is the end all be all. It's where all disease begins. It's where all health begins. And so if you're constantly feeding your gut and you have leaky gut and autoimmune conditions, it's like fuel on the fire. It's like taking lighter fluid and just shooting it at the tiny little embers, and it starts to flare back up again. You get the food sensitivities all angry again. You get the leaky gut going again. You get the immune response flared up. And so you're just driving more thyroid dysfunction instead of actually giving it all a rest. And fasting is one of the quickest ways to heal your gut. So if you really want to calm things down with an autoimmune condition or a thyroid condition, you want to incorporate fasting, because that gives your body the ability to divert resources over and start healing, start doing the process of autophagy, meaning we have cells that we send out through our body that eat and kill other bad cells that need to leave. They need to be done and gone. But if that process doesn't happen, those cells sit there and then they go rogue and they turn into cancer and disease. So we have to give that autophagy a chance, or we're just continuing to spiral down with more conditions and more conditions.
Well, thank you for explaining that. And so fasting, again, important for overall health, especially for gut healing. Like you said, we might need to go beyond that. Like if you have gut dysbiosis due to, some type of infection or, other imbalances, other triggers, we need to address that. So, but fasting helps with the gut. And then, so you're known as the Gutsy gynecologist. So I have to ask you, what's that connection then between the gut and the hormones?
Yeah, so I first started noticing this as a surgeon. I did a lot of stage 4 robotic endometriosis surgery. So endometriosis is where the cells inside the uterus that grow every month in response to estrogen, they grow and then they bleed. And that's what causes a menstrual period. But these cells get outside of the uterus into the abdominal cavity, and they can start to grow on top of the uterus and on the ovaries and the tubes and the side walls of your abdomen, your pelvis, and on your bowels and your bladder. And so it was my job to go in as a surgeon and try to separate all the adhesions and the scarring that was taking place, because the bowels and the bladder and the ovaries, they were growing together essentially from this disease process. And it was never taught to me that the gut was involved at all, but it was obvious just looking through the robotic lens that how is the gut not involved? The gut is literally scarred to these pelvic organs, and I'm sitting here peeling bowel off and taking down adhesions for 2 hours at a time. The gut has to be involved. And when I started studying functional medicine, I really began to understand that all of the things happening inside the intestines, so in the lumen, the tube where the food is being digested and broken down and turned into stool, like those processes, chemical reactions are happening, and they don't just stay in the lumen. They actually cross through that one cell layer into our bloodstream and through the serosa out into the abdominal cavity. And so if you have inflammation in your gut, you're producing cytokines and interleukins and all the bad stuff that we heard about through the pandemic in your gut, and they're seeping into the pelvis the same way that the pelvic stuff is seeping into the gut. And so it's impossible to heal endometriosis without healing the gut. It's impossible to stop fibroids from growing and fertility scarring and issues like that without healing the gut, because as long as you have inflammation processes happening and chemical reactions happening from all the bad bacteria and all the overactive immune response, you just can't stop it. So when I made that connection, it was like life-changing for my patients, honestly, because as soon as I started with their gut first, so many of their GYN problems just just went away. We weren't dealing with them directly. All the painful periods, the crazy, heavy, irregular periods, the disease processes, they start going away once you heal the gut. And it's way more in depth than that. I mean, there's certain bacteria that live in our intestines that will make an enzyme called beta-glucuronidase. This enzyme actually cuts the garbage tag off of the estrogen that we're trying to remove from our body. So if I'm done using my estrogen that I just made, I want to get rid of it. I put a methylation group on it, send it through the liver, send it to the urine and stool for removal. This enzyme from the bacteria will cut it off and help you reabsorb it through your intestines. And again, I believe it's our body's innate intelligence, because almost every single day I see menopausal women with really high beta-glucuronidase levels, and I think their body is trying to reabsorb as much estrogen as possible because they are so low in estrogen, and estrogen is protective. We also see that with fat cells. You know, women get so angry that they gain 5 or 10 pounds at menopause, like every woman almost. That is your body's way of protecting you, because you no longer have enough estrogen to protect your heart, your bones, and your brain. And so fat cells make estrogen. So we add some more fat cells to bump up your estrogen just enough to give you that protection. And we look at it as like our body's failing us, our body hates us. Why is it doing it? And that's not what's happening. It's actually, that's what's supposed to happen, unless you go on hormone replacement therapy and then that little belly fat that you gained goes away because your body doesn't need to make estrogen. You're taking it. So it's just reframes. You have to understand and believe that your body's always working for you. It's not working against you. It doesn't hate you. We just don't understand it.
Yeah, so you mentioned beta glucuronidase, so it sounds like you do like comprehensive stool tests to look at not only to see if they have dysbiosis, but see if they have an elevated beta glucuronidase. And do you also use dried urine testing, like Dutch testing, to look at the estrogen metabolites? Or?
Every day. Yep. That's pretty much, you know, I love when women do my Healthy Her program, because you have to take a comprehensive approach. You have to see what's going on in the gut. You have to see how your hormones are being metabolized. You need to see what your adrenals are doing. You need to look at that 24-hour cortisol pattern and see how are your adrenals handling your daily stress in your life. And it isn't until you see all these pictures or get all these pieces of the puzzle to see the picture clearly, then you can start to understand, like, oh, that's why my thyroid's behaving that way. This is what's going on, or this is why I just went into premature menopause, or this is why I'm infertile. So I try to get most women to do my program, which is stool testing, food sensitivity testing, Dutch hormone and adrenal testing, all up front.
I'm glad you brought up adrenals, because one question I have for you related to fasting. Any concerns with the adrenals and fasting? Like if you look at a Dutch test and if someone has cortisol levels that are sky high, or the opposite, depressed cortisol levels, along with say depressed total DHEA, like should that person fast, or should they avoid fasting?
That's a great question. And this is one of the biggest things that I address in the program, because it comes up time and time again. Either women have no idea they have an adrenal issue, they've never heard of this, or yeah, they had the Dutch test, they know what their 24-hour cortisol pattern looks like. And I would say the only real concern is when you are in stage 3 adrenal dysfunction. We used to call it adrenal fatigue. You look at your pattern and it's just kind of flatlined. You don't have a nice cortisol awakening response the first 30 minutes of waking up in the morning. That means your body's losing resiliency. It's losing its ability to respond to and give you the cortisol production that it needs to function. And so fasting is a little bit of a stressor. It's a good stressor, the same way exercise is a stressor, and moderate exercise is good. triathlon training, that's probably excessive and bad. So you have to just think about it that way. So fasting is a good stressor, but not in someone who doesn't have the resiliency to be able to respond appropriately. So if your cortisol is flatlined, you want to start with getting into a more ketogenic diet and really shrinking up your eating window, and then staying there and making sure you're having higher feast days where you're reminding your body that you're not starving, because your thyroid will respond. If you eat low calorie day after day after day, it will say, oh, she's starving us to death. Let's, turn down this production here. We can't lose any more weight. She's going to starve us. So you have to make sure you're eating enough when you are eating. That's where a lot of women are falling short, is they're trying to calorie restrict while also fasting. And that's not the most beneficial way to do it. And I would say, if you haven't had Dutch testing, you don't know what your adrenals are doing, ask yourself some basic questions. Can you get out of bed in the morning? Can you get going without coffee? Are you requiring naps during the day? And are you pretty much sleeping at night? If those things are really messed up, you probably want to get your adrenals tested,
Yeah, thanks for that. So just to clarify, so if someone does have like that low cortisol pattern, it's fine. And it sounds like it's a good idea to fast, but you just want to make sure that you're getting enough nutrients, getting enough calories, getting enough protein during that eating window.
Right. And you really need to start loving your body and giving it rest time, and helping it restore and repair, because it's in a state of severe stress. And what we are trained to do is just to push through, keep going, drink more caffeine, get more sugar, do whatever it takes, or, take stimulants. And that is not the answer, because I go through this in the book. We have two parts of our autonomic nervous system. We have this sympathetic fight or flight. It's like, if you're scared, you're going to run, or if you're stressed out, you're going to fight. And then there's the parasympathetic, the rest and the digest. And you can't be in both stages at the same time. So, like, adrenal fatigue is you were in sympathetic fight or flight so long that you can't even function anymore. And so now you have to be in parasympathetic to heal. And so I don't want anybody to get to that point, honestly. So the more you pull yourself over to the parasympathetic nervous system and really nurture that side of you, the quicker that you're going to heal. And to me, fasting with faith is one of the quickest ways to get into parasympathetic mode, because you're meditating on scripture. You're trying to listen to what God has to say for you, and you're slowing down, and you're understanding that you don't have to figure it all out. You don't have to carry all their burdens. God's got you, and he already has a great future lined up for you, and you need to just rest in him. And when you start reading that truth, the words of the Bible, you really can shift into that parasympathetic nervous system and start to heal. It's beautiful and incredible. Like, women's DHEA levels will increase. And DHEA is like our anti-aging, keep us young and healthy hormone. And we need that. But so often we start to get it really depleted in that stressed out, over adrenal state. So, I was just thinking about this morning. Everybody used to say, like, hey, how are you? And you would say good or fine. Now the answer is like, oh, I'm busy. I'm really busy. I'm so busy. Like, it's a badge of honor, like it's something to be proud of. And really, it's not. That God does not want us to be busy and overly productive. Like, we don't have to earn our salvation or our place. Like, we have to take a step back and just relax a little bit. Realize that we are worthy just because we are. We don't have to produce and perform and do all the things to earn our place, you know? And so I think we get stuck in this busy mindset, and I hear this every day from women, but I can handle it. But everybody's doing it. But that's just life. Okay, your mind can handle that stressed out life, that overactive life, that busy life, but your physiology can't. Your thyroid can't, your adrenals can't, your gut can't handle it. Your physiology still responds with a chemical reaction every time you are in a stressful sympathetic state. That's just the truth of it. Like, you study rats and pigs and people, like, that's just the response that happens. You get a stimulant, we release cortisol, we release epinephrine, we release cytokines, all these inflammatory processes happen. And then our mind is like, oh, that's fine. We just don't worry about that. We got it. Well, the physiology already happened, right? The inflammation already happened. We just killed all the good bacteria. We just caused leaky gut. We just got our immune system all ticked off. Like, it all happened. It doesn't matter now. So we really need to just start to get more mindful about how we're living, and take some authority and responsibility over the fact that what we are doing all throughout the day is completely impacting our health, and we have way more control over it than we want to admit. You know, we want to think doctors are the answers, doctors are going to help us and save us, and really your body is totally created to heal. You know, I tell people, as a surgeon, I would cut your skin open, I would cut your fascia, I would cut your muscle, I would pull the baby out and sew everything back up with sutures. I know it's kind of graphic, but I didn't actually heal you shut. I literally put some suture in there to approximate those tissues so that the muscle of the uterus laid next to each other. But if those stitches broke, you weren't healed shut. Your tissues actually have innate intelligence that they grow back together. The cells regrow together. That is what we are not believing in anymore. We're not believing that our body has any ability to heal or do what it's supposed to do. And so I really want women to understand that there's so much more of it in their control than they realize.
Yeah, so we're essentially just assisting with the healing. Obviously, like you said, it's an
Absolutely.
innate intelligence. And it's sad because I just had today, I had two patient consultations where we're talking about why can't the endocrinologist be more open-minded? They bring up diet, and it's like, no, no, and this is like for cases of Graves, Hashimoto's, no, diet's not going to do anything. You just need, like you said, you just need the thyroid hormone replacements, or in the case of Graves' disease, you just need anti-thyroid medication or radioactive iodine, and so negative when it comes to diet. But there's an underlying cause behind everything. And like you said, our job isn't really to fix the person, it's to give them the guidance and to have their body take over that innate intelligence. So I'm glad you spoke about that. And parasympathetic. So I want to talk a little bit about that. And when it comes to spirituality, religion, and then the overlap between that and mind body medicine. So, like, for example, when I have a conversation with a patient, I ask them what they're doing from a stress management perspective. So, if they are, if their response is, just like every day I'm praying, which again is important, but do they need to go beyond that? I guess, like, so that obviously your book probably talks about that, and you're talking about that now. But when it comes to, I guess, because again, some people, yeah, I guess, how much do I have to incorporate the mindfulness, and how much overlap is there between religion and, meditation, and even like those who, I mean, we could talk about yoga, anywhere you want to go, but yeah.
Yeah. So if your listeners are anything like me, I was raised Catholic. I had a lot of confusing messages being in religion and in the church, and I really pulled away from it for a long time. But I always knew that I believed Jesus Christ did walk the earth and he was my savior. So I had that belief in the back of my head, but I treated God like he was a genie in a bottle. Like, I would just wish and pray and wish and pray, and why won't it happen? And I'm just like waiting things for magic to magically happen in, within the same day of me asking for it. And that's a really scarce mindset and weak and fearful way to live. And I don't believe that's strong faith. I had to learn to actually trust God and believe him before I see it. We always want to see and then believe, but you actually have to believe and then see it. And so when I shifted how I was praying and I shifted to a state of gratitude, like thank God first and then come to him with my issues and requests, that was a game changer. That changed everything, because what I realized was you can't be anxious and worrying and in a state of gratitude at the same time. Just like you can't be in fight or flight and rest and digest at the same time. If you are saying, thank you, God, for this incredible body that got up and went to Pilates this morning. Thank you for my sweet dog giving me attention when I get home. Thank you for the warm cup of coffee that I'm drinking right now. You can't actually be worrying about stuff at the same time. And so you start to shift the chemicals that are created in your body and how you feel. When we are in a state of gratitude, we produce oxytocin, which is our love hormone, and it actually helps us feel good. We produce more serotonin and melatonin and all the good chemicals. When we are in a state of anxiety and worry, we tend to remember past events. And as soon as we remember something, our brain is hardwired to feel those feelings and create those chemicals again. So say you got in a really big fight with somebody, say somebody like did you wrong. You could probably relive that in your head right now and feel all those feelings and get the heart racing and get sweaty and like get jittery and like pumped up, like you got to talk about it, because you're making chemicals from that thought response, from those feelings. And so what I teach women is, in order to change your body, you have to change your mind. And it all comes back to Romans 12:2, that you have to renew your mind in order to be above any of this physical reality that you're suffering through. So your brain is a computer, your mind is a computer program, and it's just doing it what you've trained it to do. And unfortunately, most of the programming was done when we were young, or it's done subconsciously without much of our thoughts and paying attention. It's just happening to us. People say things and we record it and then we play it over and over and over, and we create these new nerve pathways that just get ingrained and driven deeper. And it's not until you start to make new pathways and think new thoughts and break those old thought patterns that you can create new chemicals to send a new signal to your cells that are healing and health restoring. So it all does begin in your mind. Anything that happens in the world, somebody wanted to create an airplane and get us to fly, that had to first happen in his mind before he developed the airplane physically, right? If you want a healthy body that isn't overweight, that isn't in pain, that isn't exhausted, you have to first envision it in your mind. And so I do this whole thing called future gazing with God. And I walk women through the process of figuring out, what are they struggling with? What don't they like? How do they see themselves? And then I help them envision, like, imagine seeing yourself through God's eyes, through your creator who has plans for you. Imagine what he sees you as. And how can you get to that woman of your dreams that you envision yourself becoming? And then we work backwards. What is that woman doing every day? How is she waking up in the morning? How is she moving her body? What choices is she making about food? How does she manage her stressors? And when you get that kind of clarity, you can start creating new thought patterns and reprogramming your mind, and that will change your behaviors and that will change your body. So it's a lot. I get it, but it's life-changing. It's transformational. Like watching women go through this has just been the most rewarding thing I've ever done. It's like, it just lights me up.
Yeah, no, thanks. I asked you that question just because it happens a lot. Well, I'll talk about trust management, and the person will say that, typically a woman will say that I'm praying and that's my form of stress management. And, I always give a positive response because I think that is great and I think that is helping. But it sounds like many times they do need to go beyond that, to go deeper, at least to get into that parasympathetic state.
Yeah, unfortunately, a lot of prayer is actually um, bad repetitive thoughts. It's a negative feedback loop of worrying and praying and asking God to fix something that he doesn't necessarily want to fix. He might want to be teaching you a lesson. He might be showing you all kinds of doors you're supposed to be going through, and you are so stuck in that symptom that you can't see it. So sometimes we have to get a fresh new perspective, honestly. Like when I was so overworked as an OBGYN, like I work in a small town, I was on call every other night. I was exhausted. I could not remember my patients' names from the deliveries the night before. Like I literally could not remember stuff. I had to rely on my assistant. And that was really eye-opening for me to understand that none of that was ever going to change until I decided that it was no longer something I was going to tolerate, that I was going to put some boundaries in place, that I was going to shift my mindset about things, because I believed I was supposed to be exhausted and overworked. I was trained to think that you hold your bladder and you don't eat and you just struggle through and you keep on going and you always put the patient first. Like that was my mindset. That was my belief. And it wasn't until I realized God gave me this body and I am not honoring him by treating it like a garbage can. I need to actually shift and change how I'm treating myself, because that's going to be sustainable. You cannot continue to pour from an empty cup. Like you just can't. So it wasn't until I shifted my internal mindset to believe that I can have boundaries. I can work less. I can sleep more. My patients will survive if someone else takes care of them. Like I had to shift so many beliefs. And once I started to do that and started like focusing on me and my health and my body, that's when everything changed. So a lot of people need a new perspective, unfortunately.
Yeah, I definitely agree. So yeah, thank you again for sharing that. And well, Dr. Tabitha, you again shared a lot of great information. I know people are, probably really excited to read your book. And before you talk about more about where they could get it, is there anything else that I should have asked you that I didn't ask you, or any last words, anything else that you want to talk about?
I just want people to know that you're never too far gone. Like I had a 70-year-old woman do the online program for Lent last year. She had uncontrolled diabetes at 70 years old. She had a wound that wouldn't heal because her blood sugar was so elevated. Her hemoglobin A1C was 8.5 going into the program. That is really uncontrolled. And she decided she was going to give it a try. And she didn't believe that she could do the whole thing, but she started believing she could at least do the day. And so we took it day by day. And by the time we got to an extended fast, she was like, I think I can do this. I really think I can do it. And she completely did it. And she felt so empowered, and it absolutely shifted everything. This is a woman with fibromyalgia and chronic pain and non-healing wounds and everything you can imagine, a list of drugs that she's on. And by the end of it, her hemoglobin A1C was down in the sixes, and she was out moving her body like she hadn't in years. And she was like the greatest example to me, because she thought she was too far gone. She was believing the lies that it's too late. I can't heal. My body can't change at this point. And, I was a little skeptical. She was 70. That's a lot of comorbidities, right? I'm like, I know it works in like 40 and 50-year-olds, but man, did she make me a believer. And so I love that story. And the fact that I had Hashimoto's at 17 and my antibodies were sky high, and now they're down in like single digits. Like, you can reverse stuff. Your body wants to be in homeostasis. It wants to heal. It is always trying to heal, and it's in a constant state of healing. It's only us interfering that it gets into a state of not healing. So if you just shift and choose to believe and know with all your being, just as the sun rises every morning, the sun is going to rise, just know your body's going to heal. Your mind will start to find those solutions and those opportunities for healing. Like listening to the podcast today, like, oh my gosh, I've never thought of fasting. Let me try this. Let me see. Like, God just gave you a new possibility. So that's what I would say, is you cannot give up hope.
All right, wonderful. Well, thank you. Where's the best place people could go to get your book, Fast to Faith? Is it Amazon or your
Go
website?
straight to fasttofaith.com, because right now, if you get the book, we're giving awesome bonuses with it. We're giving like $20 to the supplement store. We're doing extra scripture bonuses. And then I'm doing a really awesome masterclass where I'm doing a deep dive. It's called Ultimate Transformation, and it's only for the people buying the book right now. So I'm really excited about that conversation, because you get to like interact with me one-on-one and ask questions and all the good stuff. So
Okay, so fasttofaith.com, and then they could, once they buy the book, they get access to that masterclass you mentioned?
yeah, exactly. They just put their order number in and we'll send it to you.
All right. Also, check out Dr. Tabatha's amazing podcast, the Gutsy Gynecologist Show. And also, there's a free guide, the Gutsy Gynecologist Guide to Balancing Your Hormones. And I'll include a link in the show notes to that, as well as your other, like your social media and obviously the book. So everything will be in the show notes. But this was a wonderful conversation, Dr. Tabatha. Thank you so much for your time. Appreciate it. Best of luck with your book. I mean, again, I'm very excited about it, and think it's going to do amazing.
Thank you. I'm so honored that everybody just took the time to listen today and they stayed with us. So thank you so much.